Good evening and welcome. I'm James Liu, and I'm a librarian at the Stanford Health Library. Thank you for joining us. Our talk tonight is entitled Medicare Open Enrollment, Maximize Your Benefits. It's my pleasure to introduce our speaker, Maha Justi. Maha Justi is a volunteer with HICAP Medicare counselor and is certified by the California Department of Aging. Maha has been assisting Medicare beneficiaries for the last 15 years with all their Medicare questions. She's a retired Silicon Valley engineer who enjoys helping seniors and their families navigate complex Medicare issues. Throughout this talk, please enter any questions in the Q&A box at the bottom of your screen. At the end of the talk, Maha will also answer as many of those questions as possible. Over to you, Maha.
Thank you so much, James, and thank you, Stanford, for hosting us. Thank you all for attending. Hopefully, we'll have a very informative talk for you tonight. And let me get going and share my screen. The topic today is Medicare Open Enrollment. Let's start by introducing ourselves. We're HICAP. Who is HICAP? HICAP is an acronym for our organization, Healthcare Insurance Counseling Program. Our goal is to educate, assist, and advocate for seniors in our community. Our services are free, unbiased, and confidential. There is an organization, HICAP, in every county in the entire country. And actually, the name slightly changed. The official name is SHIP, State Health Insurance Program. We are mostly a volunteer-supported organization. I'm joined here with one of my colleagues, Ali. We are both a long-term volunteer with HICAP. So tonight's agenda is basically open enrollment. But to understand what to do in open enrollment, one must know what you have first. And the terminology in Medicare is very, very important. So I'm going to talk about something called original Medicare and a supplement. I'm going to talk about a concept called Medicare Advantage and a little bit touching on a retirement plan. Once you understand exactly what coverage you have, then we move on to what's new in Medicare in 2025. We have lots of changes, open enrollment, what it is and what you should absolutely do during open enrollment. And I'll end up with some additional resources and how we could help you. Okay, so let's get started from the very beginning. There is something called original Medicare. And again, the terminology is extremely important. Original Medicare is a federal program that's composed of two parts. Part A, which is hospital insurance. Part B, which is doctor insurance. If you are already on Medicare, you typically have this red, white, and blue card that gives you information with an important number and your effective date. It is a federal program that you have basically paid into during your working years. The enrollment for original Medicare is controlled by Social Security Administration. Because to qualify for Medicare, you have to be 65, but also you have to have paid into the Medicare system via your Medicare payroll tax. So Social Security Administration is the entity that you go to when you want to enroll, and is also the entity that decides how much you will pay as a premium. Once you're inside the program itself is managed by Center for Medicare and Medicaid. It's called CSF. Both of these are federal agencies. Now, anytime we talk about any kind of insurance, we have to talk about how much it costs in three different ways. We talk about the premium. In the hospital portion, most people who work at least 10 years and pay their payroll tax in the US, they have a premium of 0. However, Part B has a monthly premium, and it changes every year slightly. So in 2024, it was somewhere around $175. I believe in 2025 is going to be 185, but that number is not released yet. It will be soon released, probably by the end of the month. So this is the number that you have to pay every month. Now there's something called deductible. So the deductible is the amount of money you have to put out yourself before Medicare start paying for you. So when it comes to the hospital portion, that number again changes, and it's somewhere around $1,600. Again, it changes every year, but it's not per year, it's per benefit period. And the benefit period is 60 days. So to kind of understand that is you break your arm, you go to a hospital, the first thing they want after taking care of you, they want the $1,600. You go, you leave, you don't have any incidents, you come back on day 61, your benefit period has expired, and they want that money again. So that could be quite substantial. Now, as far as Part B, which is the doctor's part, it's a flat number per year, and in 2024, that number was $240. Last but not least is the copay. So once you have paid your deductible, then what do you pay every time you have a service? In case of hospitals, it's zero for the first 60 days. In the case of doctors, it's 20% of an assigned bill. What does that mean, assigned bill? Medicare goes and make contracts with doctors and assign an amount of money for each diagnostic code. So for example, Medicare might say a doctor office visit is $100, just as an example. So with $100, Medicare will pay 80%, which is $80, and you will pay 20%, which is your share of it. Then you look at all these things and you say, gee, that's kind of a lot of financial exposure there. We call those gaps. So a lot of people with just original Medicare feel uncomfortable from a financial point of view that they might have to pay too much. So what can be done? There's ways to close these gaps. So starting out with the original Medicare, there is something called Medigap. Notice the word gap. So the whole purpose of this insurance is insurance that is offered by private companies, and it supplements A and B. So it pays whatever A and B does not pay. So this insurance, I'd like really think of it not as medical insurance, it's really more of a financial protection plan, because these companies here have zero say about your healthcare. If Medicare pays, they will pay. If Medicare doesn't pay, they will not pay. So there is very little to argue with them over. What do these plans look like? When you go out and buy these plans, you look at the gaps. So here are the gaps or the benefit they offer. The question is how many of these gaps you want to close, then you buy the plan that you think is fit for you. If you are eligible for Medicare after 2020, you don't have these columns here. So the best you can buy is a plan called G, as in gold. So this plan basically covers everything that original Medicare does not cover, except for that $240, which you have to pay yourself. Now, the lowest plan is A. So you see all these X's here. So you decide on your own how much financial protection do you want. And be aware that once you start on a high plan that has a lot of coverages, as you get older, you can always go down. But if you start here, you cannot go up. Okay, so again, you have the original Medicare. If you have it, it becomes your primary insurance. So the bill goes from your doctor to Medicare. And then your secondary, it becomes your Medigap. So the bill goes from here to here. And if you have, for example, Plan G, you don't see any bills. So is that enough? That's not really enough, because we haven't addressed prescription drugs. So prescription drugs, Part A does cover some medication, typically the medication that gets injected at a doctor's office or a hospital. But for the medication that you take at home, you have to go out and buy another insurance, which is called Part D. It's private insurance that you take from a private company. So as a summary, 50% of the people eligible for Medicare have this kind of structure, what's called original Medicare, and they go out and buy the supplement to complement or supplement what they have. Okay, so is this the only way to get Medicare? No, there's another way to get Medicare. It's called Medicare Advantage. So let's talk a little bit about what Medicare Advantage is. So starting out with the original Medicare, then you can actually move to something called Medicare Advantage or Part C. So the first thing I wanted to say, Medicare Advantage is not an advantage or a disadvantage. It's a marketing name. Part C is actually not part of anything. It's all in one plan. It's a completely private plan. So when we talk about a Medicare privatization, that's what it is. You take this entire stack, you take this part here, and you go to one plan that is supposed to take care of you and everything you have to do. So what do these plans look like? So these example of these plan is Kaiser. Kaiser is a Medicare Advantage plan. Another one might be called Alignment. These are insurance company that offers you all-in-one plan. Or you could have ARP United Healthcare. They also have a Medicare Advantage plan. So what do these Medicare Advantage plan look like in general? Again, they're private insurance, completely private insurance. They are supposed to offer you services for hospitalization, for doctor, for medication. They are typically network-based, and this is the only insurance you have. You don't have a primary and secondary. You only have that insurance. So what else can you have? Well, you can have an employer-based plan. So employers could decide to act as your supplement. So instead of asking you to go and buy a Medigap plan, the company themselves, whether it's Apple or IBM or any of these companies, they can go out and make a deal and with United Healthcare and offer a supplement that looks similar to a Medigap plan. They could also go and make a Medicare Advantage plan. So they can decide, we're going to roll it out and we're going to offer our employees only a Medicare Advantage plan. So now that we have an idea what original Medicare looks like and what a Medicare Advantage look like, so let's just a little bit more detail. A Medicare Advantage plan is typically very regional. So San Mateo County, so you can only buy the plan in San Mateo County, on Santa Clara County. The coverage, the doctors they have might go slightly outside of the county, but pretty much regional, except in emergencies. HMO, you always have to have a primary care physician who will refer you to a specialist. On the other hand, if you have the original Medicare with the supplements, it's nationwide. You could get on a plane and go to a doctor in Florida, or you can go to the Mayo Clinic. You can go anywhere you want that except Medicare. It's a fee for service. So as long as the doctor or the hospital have a contract with Medicare, the federal agency, then you don't need anything. There is also the concept of self-referral. You don't need anybody to tell you to go to a dermatologist. You can just make an appointment and go to a dermatologist. So let's make an example about what cost might look like. So let's take somebody who's 75 years old, San Mateo County, and decide to buy the best that is offered, which is Medicare, Medigap G, and a prescription drug plan called Value Script. There's a whole bunch. There are maybe 30 different plans, but let's say they chose this one. What is the cost? Well, first of all, there is the federal part, and the federal part basically dictate you have to pay the monthly amount and you have to pay the deductible. So that's basically goes to the federal. The private part, well, these guys here, the Medigap people, want a premium. So for somebody who's 75 years old, that premium could be somewhere around $200 a month. And that's basically it. Once you pay your $200, you are done. you don't have any copays after that because you have Plan G. Now, for a prescription drug plan, well, this particular plan happened to be 40 cents a month. There are plans that are over $100. So that really depends on the medication you take, and we do a search and decide which is the best for you. Maximum deductible allowed is $545. These private companies could decide to have a zero deductible, but basically it's this is the maximum. There's a copay. Well, the copay depends on the medication and the tier of the medication you take. So that's basically your financial liability if you have the original Medicare. So let's compare that with an MA plan. Now, in an MA plan, you still have to pay the part for the federal government. So what actually happened, you still have to pay your premium, and that premium, the Medicare agency will take it and give it to these people. So you still have to pay it. Premium, so in this case, I picked an alignment. It's one of the health insurance plan. So this plan is $48 a month. Okay, that sounds really good. So people could look at that, and they're very, very aggressively marketed. They say, well, $400 sounds pretty cheap. But they forget the fact that they still have to pay this amount of money because sometimes it's taken automatically from the Social Security, so they don't see it. Well, now the other thing is the copay. Fundamentally, all Medicare Advantage plan is basically pay as you go kind of a service. So you go to a doctor, you pay $20 or $35. You go to a hospital, you might pay $300 per day. You go to an X-ray, you might pay 30%. So if you're extremely healthy, you're not going to see any cost. But if you're sick, that could really add up. And there's something called maximum out-of-pocket. And for this particular plan, it's $3,900 a year. So you have financial protection. Okay, what about the Part D, the prescription drug? Well, the prescription drug does not have a premium because the premium is already rolled into here. There is no deductible, but again, medication is paid as you go. So if I put them side by side, here's Medicare Advantage, here's original Medicare with a supplement. The Part B premium is paid for both, so I take them off the table. The Part D part of it is depending on medication, take it off the table. So this is really what the picture comes down to it. You might look at this side and say, gee, I have $240 per year deductible, $200 a month, but then I'm done, right? For the medical part of it. Now, in this case, I say, I have zero. That sounds like really great news. $48, yes, also very good news. But what happened here? We don't know. And this is the biggest mistake that people do, is they just look at these two numbers and say, I got a very cheap plan. But they don't anticipate what happened in this period here, whether you're going to be very healthy or very sick. Another point to mention here is once you get in these plans, and you stay on it for 1 year, you cannot go back and buy these Medigap plans. So this is a decision you have to do early on, very consciously. Okay, so for this part, you should be able to know what insurance you have. This is all you need to really be able to get from this section of the presentation. Are you with original Medicare with a supplement? Is that your current insurance? Do you have a Medicare Advantage plan? Or do you have an employer plan? And believe me when I say a lot of people are totally confused. They don't really know what they have. And the reason for it is because one company could be selling a Medicare, for example, take ARP. ARP could be selling you a supplement plan. It could be selling you an HMO plan, and it could be part of your employer retirement plan. So if somebody says, I have ARP, that tells us nothing. So you really need to know if you're here, or if you're here, if you're here, because knowing this would enable you to understand what can and cannot do during open enrollment. So this is the first point where I have a stop for questions. Do we have questions? Anybody say anything?
So Maha, this is Ali. So there were some questions in the Q&A that
Okay,
I've tried to answer on top of the Zoom.
okay,
I've tried to answer some of them as you were speaking, but I'm pretty sure if anybody else wants to chime in, we
okay.
could definitely
So,
answer those.
okay, so if there are no other questions then in the chat, then I shall continue then. Okay, so let's talk about 2025. Let's say what's new. So if you recall something called Inflation Reduction Act, it was a congressional act that started targeting Medicare cost reduction over a period of time. That period of time started in 2023. Started out by having vaccines without copay. Remember the days before that where if you wanted to take certain vaccines and they were extremely, like shingles vaccine, extremely expensive. Now the copay is zero. What also happened in 2023 is insulin copay was limited to $35 a month. What happened in 2024, there's something called Extra Help, where it's just a resource for lower income people to get assistance for paying for their medication. And that assistance was asset-based and income-based. And things were really relaxed in 2024 that allowed more people to participate in this program. One other thing that was very important happened in 2024 is when you buy your medication, there are different phases. There is an initial phase, there is a coverage gap. It used to be called donut hole, and then the catastrophic. And that catastrophic, it used to be that once you get there, which basically is spending something like out of pocket, something around $3,500 or so, you have to pay 5% of every medication you buy. So for people that got really expensive medication, like if you have a cancer medication that costs $10,000 a month, 5% of that is a substantial number, and that number could go every month for all your medication. Now, in 2024, that 5% went to zero. So it was really a godsend for a lot of people that have high cost medication. What could we look forward to in 2025? Well, in 2025, part of this Inflation Reduction Act is the cap of everything you pay out of pocket for prescription drugs was going to be $2,000. So this is the most, this does not include the premium. So, but outside of the premium, the maximum you're going to pay in 2025 is $2,000. We have not seen the premium for these Part D plans yet, and we're very anxious to see, for example, these 40 cents plan, if they're going to stick to that or are they going to jack up the premium. We'll wait and see. But this is a very important cap that we get as part of the Inflation Reduction Act. Another thing is, typically when people start the year, while they're in the deductible phase upfront, they might have very high expenses. So there is an option to smooth out or spread out your annual cost over the 12 months. This is something that you have to opt in. We don't have a lot of the detail of exactly how that opt-in is going to happen, but you need to be aware of it. If you'd like, it's like, you know, when you get your power bill and sometimes they say you don't have to 1 month pay $100, and in the winter when you're using gas, you have to pay $500. We're going to smooth it out. So this is kind of a similar concept. So let's talk about open enrollment. Open enrollment is for people who already have Medicare. It is once a year that start every year, October 15th, and end December 7th. So during that time, you look at what you have and reevaluate it. That coverage begins the following year, January 1st. So this is a decision you make during this time in order to decide what the coverage going to look like for January 1st. Okay, so let's go further and understand what we can and cannot do during this period starting October 15th. Well, you can change between your MA plans. For example, you have United Healthcare, AARP, you decided that you hate it because the number of doctors is not adequate, or for whatever reason you hate it and you want to go to Kaiser. You could do that. This is a time to compare all these plans and understand what network of doctors they have and switch between them. The other thing that you could do during open enrollment is you could add or change your medication, your Part D prescription drug plan. Your medication could change, but the plan itself could change. So we have found many cases where people say, oh, I have a Part D plan. I love it. It works perfect for me. They don't check. They come January 1st. They find that the medication that they were paying $10 as a copay, all of a sudden they're paying $50. So we say, please check during open enrollment to ensure that whatever plan you love, you will still love it in January, because come January, then you're stuck with it for the rest of the year. What else can you do? Well, you can change between Medicare Advantage and the private and the original Medicare. But I have to be careful when I say that. You notice here, I didn't put Medigap here because Medigap has absolutely nothing to do with open enrollment, or I should say very limited to do with open enrollment. Medigap is a plan that you get when you turn 65 and you're eligible for it in the first 6 months after Part B, but then you have it or you don't have it. Now, if you are here and you stay here for, let's say, 2 years and you go back, you want to go back, you can always go back. You can always have the original Medicare. You can always buy a Part D, but you don't have a federal guarantee to buy a Medigap plan. So they might take you, they might not take you. So when I say, if you're considering making this transition, please talk to us so we can navigate the situation and you understand your rights. Okay, what should you do in open enrollment? Well, you get something called ANOC, which is the Annual Notice of Change. And honestly, a lot of people just look at it, roll their eyes, and just put it on the side. And we say, please, please take a look at it. This is a very, very important document. What do you have to do with it? Basically tells you, oh, here's your new premium. This is coming from either your MA plan or it's coming from your prescription drug plan. So it's coming from a private company to tell you what changes they're going to have next year. So we tell people, please pick up the phone, call the company, ask them, is your doctor still on it for next year? Is your hospital still on it for next year? Is your medication, what does it look like? And there's software that you can, Medicare.gov, what you can analyze. If you don't do that and you have a nasty surprise in January 1st, then your entire network of doctor is no longer contracted with your Medicare Advantage plan, then you're really out of luck. And if you call your insurance company, they say, okay, what's the problem? Go to another doctor. And so you have to go hunt for another doctor. So again, this is the time to review this information and to switch. I should also say some people who got on Medicare Advantage and decided they really hate the concept because of the restriction, the authorization, they'd rather be on the original Medicare and a Medigap, but they don't have a Medigap guarantee issue. Sometimes if you really analyze this document, they have rules, and the rules, for example, if a cost goes over 15%, you have the right to bail out and get a guarantee right again. So this is like a lifeline, if that's what you're looking for. But again, if you find yourself that you really hate what you have and you wanted to switch, we really encourage you to talk to us. So how do you analyze these plans to start with? there is a very, very good website called Medicare.gov, and you go there, not Medicare, anything else, not .com or .org, it's Medicare.gov. You go in there, and if you have a Medicare, My Medicare account, is great, but if you don't, you could do it as a guest. So you say, I want to find a plan. And basically it sends you to something here. And in this case, the 2025 is not online yet, but it would be, say, what you're looking for. Are you looking for 2024 or 2025? You click on the right amount and you put your zip code, because it is zip code specific. Then it'll say, okay, what are you looking for? Are you looking for another Medicare Advantage plan? It's called Part C. Or are you looking for a Part D? Or are you looking for a Medigap? But remember, during open enrollment, you're not doing anything with Medigap if you don't have a guarantee issue. So you go, and there are menus. You step through the menus and you get a list of what is this, what is the premium, what is the deductible, what is the copay, are your medication covered, are they not covered? And again, if you are not clear on that, we can help you. What we also do at HICAP, we make a big table with all the plans, Medicare Advantage plan available in our county, and basically say, here they are side by side. This is kind of a first cut, and you need to verify it, but this is just a really good first cut to look at. Okay, what else should you be looking for during open enrollment? Well, your MA, Medicare Advantage, could leave the market. For example, they could say, well, there's not enough money for us here. We're going to leave Santa Clara County, or we're going to leave San Mateo County. So insurance plan itself decide to leave. If that happens, you get the Medigap guarantee, which means that you can buy a Medigap without any health underwriting, medical exam, or anything. So this is something very important to look for. Also, something very important to look for to maximize your saving as you look in all these plans, especially when you are Medicare.gov and you look at your medication, you get a list. And the list would say, what pharmacy would you like us to look for? They give you a choice of 5 pharmacies. And you put Costco, you put CVS, or you said, no, I'm only going to go to CVS, so I'm only going to go to Walgreens. Fine. Then you get a printout, and the printout tells you how much you're going to pay as a copay when you go to the pharmacy to pick up your medication. But very important is to watch that this pharmacy has the part that says it's preferred, because they're preferred. There is in-network, there is out-of-network. So the insurance company has contracts with different pharmacies. We get people saying, I go to Walgreens, so do my search in Walgreens. So we do it for them, but we find that maybe Walgreens happen to be, for some of the medication or for this particular insurance, is out of network, or it's in network, but it's not preferred. And so we would say to the beneficiary, we say, would you be willing to save $500 by going to CVS instead of Walgreens? Some people don't even know that this option exists. So we say, please make sure that you see in your printout preferred. Okay, so what happened if you did everything right, you checked everything, and you still got in trouble once the year started? Well, there's something called continuation of coverage, which means is that you start the year, you have a doctor, and you've been going to a doctor, being actively treated for a serious condition, and you just learned because you didn't check, maybe, or you did check and the doctor just left the network for that particular insurance Medicare Advantage plan, but you could petition and ask for a continuation of coverage, so you can safely continue your treatment until you're able to switch to another doctor. Same thing happened here with formulary exceptions. Sometimes throughout the year, well, you don't know exactly what potential medication you're going to need throughout the year. You might not have a chronic condition that you know exactly what you're taking, but during the year, something comes up. So when that something comes up, there could be not any formulary for the company that you picked, but you could also ask for formulary exception. Remember, these are private companies. They may or may not accept that, but you need to know that you have that option. And in a lot of cases, you are successful to be able to do that if you try. Last but not least, if you've done everything right, you picked up the phone, you called and you say, I want to make sure that Dr. Smith is still in your network for January, and so on and so forth, and you went through the entire list, or you got a call from a Medicare Advantage plan that says, oh, change to this plan, it's 0 premium, doesn't cost you a penny, and you get to keep all your doctors. Well, and you do switch, and you find out when January 1st comes along that that's not true. Now, if you get that call, or if you have that talk with any of your insurance people, get their name, get the date, make a note, write it down, because if it turns out there is marketing misrepresentation, we can help you call Medicare, the federal agency, and petition for a special enrollment, meaning somebody lied to you and you want out. And this is something that we can help you do. And then your insurance, you don't have to be stuck with it for the entire year. You could potentially be able to get it the next month in case of marketing misrepresentation. Again, a lot of people do not know that this is an option that they have. Okay, what other resources are available? Well, there are state programs. For example, Medi-Cal. Medi-Cal is for lower income beneficiary. You could have Medicare and Medi-Cal. In this case, Medicare, if you have full Medi-Cal, basically you enroll in a program and it's income based. So you would have to apply for it. There's a lot of Medicare saving programs. There's also extra help for prescription drug plans. So if you are in a lower income, please reach out. We can navigate and help you find out the correct program for you. There's also a load of private programs. For example, if you are at a certain income bracket that tend to be more generous than the lower income for Medi-Cal, private companies, private institution, Kaiser, Stanford, they have financial assistance program. They might waive a lot of extra cost that you might be liable for. So check those institutions or ask us and we will tell you if they have it or not. There's also a program that is from the pharma industry. And there's a website there, it's called needymeds.org. And there you can go in there, find your medication, find if the pharma industry has a program for your medication. Potentially you can get this very expensive medication for nothing. And I can tell you for sure that these programs are completely underutilized because people don't know about them. And the pharma industry is only happy to show how generous they are because they make a lot of profit and they wanted to show how generous they are. So they do go out of their way to try to get you into the program. All you need to do is to apply. Last but not least, there are discounters. There are people like GoodRx and other ones that you can compare. If your copay is too high, sometimes you can get this discount. There's advantages and disadvantages. If you go and use a GoodRx coupon, the amount of premium that you pay does not go, or the amount of copay that you pay does not count toward your out-of-pocket maximum to reach that $2,000. So there's advantages and disadvantages. But those programs do exist. Okay, so to summarize, you need absolutely understand what you have. Understand, are you original? Are you Are you Advantage or are you retirement employer plan? Verify what is 2025 plan look like. Again, we're saying we don't really care if you love your plan, you still have to verify it because they might not love you back. The worst thing, absolute worst thing you could do is nothing, because then it's too late and then you get yourself in a situation in January where you more or less stuck. Okay, so how could we help in HICAP? We offer one-on-one counseling, case by case, either by phone or in person. We are located in a lot of senior centers. We can assist you to enroll in a plan if you are not sure how to enroll. We can get on the phone with you. We can assist you in appeal. If somebody is saying that we're not paying for that claim and you're really lost as far as how to file a claim, we can help you do that. We can call Medicare on your behalf. We have a hotline for counselors for Medicare. You don't have to be on the line waiting. We have actually second-level Medicare people that would answer their phone, and we have a blanket permission to talk about your case without you being there and solve whatever situation you might be facing. Again, our goal is to educate and advocate. We want you to make informed decision. You could pick whatever insurance you want. We do not tell you what insurance you should pick, but we want to make sure you choose your insurance based on understanding of the pros and cons. Okay, and that's pretty much it for me. Any questions?
So Maha, there are various different questions out
Okay.
there. I'm just
Go ahead.
gonna, on the QA side, I believe, I'll start from the first one that came up. I believe the first question is, I'll be 65 in November, and I'm just learning about this. This is the first time I'm hearing the term Medigap. I'm confused about choosing a plan G or a lower cost, and I'm not able to switch after 1 year. So just confused
Okay.
about the plan G.
So this is exactly what we do at HICAP. We offer these counseling sessions, and it's absolutely essential that you understand your choices. So when you become eligible for Medicare at 65, depending if you're working or not working, if you are working, you may delay enrollment because you might be actively working and on an employer plan. However, if you are not working and you want to join Medicare, then you need to enroll using Social Security for A and B. And once you enroll in A and B, then you have these choices. Do you want a supplement? And we can explain to you these Medigap plans, which is a private plan to supplement. We explain the Part D plans. Do you like this scenario, or you want to completely go to a Medicare Advantage? This is exactly the kind of things we cover to new to Medicare people.
Perfect. The next question is, if you enrolled for the first time before October 15th, can you change your plan in the open enrollment?
Yes, so enrollment is based on your age, so the month of your birthday. So your effective Medicare, if you're born in July and you turn 65 mid-July, your Medicare becomes effective July 1st. So you pick a plan. If you pick the traditional Medicare, original Medicare, and a Medigap and a Part D, the only thing during your enrollment in July, you already picked the D. But let's say you don't like that D. During open enrollment, you can change that D. So regardless when your birthday is, once you have Medicare, you have the choice during open enrollment to make these changes. The changes I talked about, to change to go to another Medicare Advantage plan, a Part B plan, or go back and forth between Medicare Advantage and original Medicare.
The next question is, I'm turning 65 in November, and will I be on Medicare for December? And then could I change my plan for January? I will not be taking Social Security. I currently pay for a private Sutter health plan. I do not have employer-based insurance. I'm assuming it's Obamacare ACA.
Okay, so when you turn 65, and remember, you cannot stay on ACA if you're eligible for Medicare. So regardless, when you're born in November, your Medicare will be effective independent of open enrollment. It would be effective January 1st. Then you have this it's called initial enrollment period. So your initial enrollment period is open, and hopefully you applied before November, so it becomes November 1st. So you have a plan in November, and that plan is effective November. So you have insurance in November. If you you pick that insurance November 1st, and you stayed on that insurance November 1st, and it just so happened to be the Part D, your Part D is effective until the rest of the year. So November, December, your Part D is effective. Now, any choices or changes you make during open enrollment is not effective until January 1st. So a scenario might be you went with original Medicare and a Medigap and a Part D. You have a Part D and you bought Part D, and it's effective November and December. Then sometimes during that time, let's say in the beginning of December, still open enrollment, you decide, oh, I made a mistake. I don't really like it. You can still change, and in January, you would have a different plan. So you kind of like in this case, you would have the benefit of initial enrollment and open enrollment. And again, if you're not really clear about the timing, because it could be confusing, have a counseling session and we could draw it for you on a piece of paper so it's very clear.
So Maha, the next question is, I'm 68 and is still employed. It doesn't specify whether employed by an employer with more than 20 or less than 20 employees, but it says I'm still employed with my employer's health insurance. When I retire, am I still able to get Medigap?
Absolutely. So Medigap have a number of cases where you get that guarantee. So what happened is, if you're employed and you, let's assume it's a larger company, and you have an active employment plan. If you have an active employment plan, you could delay enrollment into Medicare. So you don't need to have Medicare. Most people would take A because the premium is 0. But there are cases where you don't want to take A. But for sure, a lot of people don't want to take B unless their company mandate that they take B. But in any case, once you retire, you are eligible for something called special enrollment period. And special enrollment period, basically, you go to Social Security, let's say you're 68 or 69, you go to Social Security and say, oh, I'd like to enroll in Medicare. They look at you and say, where have you been? You should have enrolled when you're 65. And by the way, from the time you turn 65 and you haven't been enrolled, we're going to put penalties for every month you delay. You didn't enroll in B or D. So where have you been? And you say, oh, I've been working. I've been covered under an employer plan. They say, oh, that's a different story. So take this piece of paper, give it to your employer to certify that you were covered under the employer plan, and bring it back to us. And with that, we waive all penalty, and you get a special enrollment period as if you are brand new to Medicare. And you have a complete 6-month open enrollment period for a Medigap plan. So you don't lose anything. Now, this is not the case if you are in a retirement plan. If you're in a retirement plan, it doesn't shield you. So you cannot say, go to Social Security and say, I've been in a retirement plan for 10 years and now I hate it, I want to get out. And they would say, okay, but you don't have a guarantee right for Medigap. Very big difference between an active employment plan and a retirement plan.
So Maha, we have 13 more questions to go.
Okay.
So the first one says, can you provide some clarification about how your choice of plan available to you appears to be based on which county you live in, even though you may find a medical doctor in a different county who accepts the plan in your county. Medicare has information. Does Medicare has information around which plans are authorized for each county?
Okay, very, very good question. So when an insurance company applies to get insurance from Department of Insurance to get allowance, it's county-based. So they say in San Mateo County, we're gonna only sell this plan. And they say, great. Now, so that only means that if you live in that county, this is the only plans, you can only buy plans in your county. Now, the plan itself goes off and creates a network of doctors. Now, the network of doctors can cross county line. So you could be in San Mateo County, and the plan says to you, we're talking about Medicare Advantage. Medicare Advantage says, not only do we have doctors in San Mateo County, but we'll also have some doctors in Alameda County you can go to, some doctors in Santa Clara County. So the concept of network, basically, it's completely up to the insurance company how they form their network. But as far as you as a consumer could only buy the plan itself and pay the premium for the plans offered in your own county. You cannot go buy a plan that is offered in Santa Clara County. So again, you buy a plan in Santa Clara County, but that plan could choose to have doctors in other county. That's completely up to them. I hope that explained it. It's a little confusing, but bottom line, you can only buy a plan from your own county. You cannot buy a plan from another county.
And Maha, again, I think this is also, as you said before, Medicare Advantage versus Medigap, right? A lot of the county limitations, a lot of times related to Medicare Advantage. Am I right?
Exactly. So if you remember that foil, that whole concept of county and region does not exist in the Medigap world. Medigap world, you can go anywhere in the country. It has no boundaries. So that's very important to understand.
Absolutely. The next question is, Christine is asking, if you have COBRA and COBRA is running out in a few months before you qualify for Medicare, what options are there? So I'm assuming, I'm not sure exactly what the age is, but I'm assuming perhaps she's just waiting to turn 65.
Okay,
that is why.
So COBRA is extremely tricky. So let me explain. So there are two scenarios. So if you are on COBRA and you become eligible for Medicare because you turn 65, COBRA will end immediately. If, on the other hand, you had COBRA, but while you had COBRA, before you had COBRA, you already had Medicare. Let's say you were working and you had Medicare, or you were eligible for Medicare. You turned 65 and you're still working, which makes you eligible for Medicare. So you're eligible for Medicare. You're now leaving your job. You didn't sign up for Medicare, but you're eligible for it. Then the company comes and says, oh, we can offer you COBRA. So you say, okay, I'll take COBRA. You take COBRA. Then in this case, Medicare is your primary, COBRA is your secondary. So let me say that again. Medicare is your primary, even though you didn't sign up for it, but you're eligible for it, but it's still your primary. So what happened very often is you have a scenario where somebody is not aware of this. They have never signed up for Medicare, and they got COBRA, and COBRA has been paying because COBRA didn't know, they didn't check that you were really eligible for Medicare or not. So they kept paying as a primary. And then one day they decide, oh, wait a minute, you're eligible for Medicare. So why are we paying as a primary? We should be paying as a secondary. We want all our money back. So we tell people that could be a really real messy situation. If you have a Medicare first and then you become eligible for COBRA, be aware that Medicare is your primary, whether you signed up for it or not. And again, if you need more discussion on this, would be more than happy to spend hours talking to you about it. Go ahead.
That's the other thing I just want to emphasize is that we can only address these questions in 1 minute bits, but normally when people call, we spend an hour and a half breaking down their specific needs, doctors' questions, medications. So bear in mind, there's only so much that we can possibly answer here today. The other question is, would you cover a little bit around region, state, country coverage by Medicare? So I'm assuming the question is if you sign up for Medigap or Original Medicare versus Medicare Advantage, what is the coverage?
So if you have an original Medicare and a Medigap and a plan, and you go visit your daughter in Colorado and you stay there for a month, you could absolutely go to any doctor that accepts Medicare. So if you have Medicare, original Medicare, there is no regional boundaries. You can go anywhere you want. Now, that's not the case if you have a Medicare Advantage. Medicare Advantage is only valid for your network. So if you go to a doctor outside of that network in Colorado, you will have to pay for it yourself, except in emergencies. If you are in an emergency and you happen to be in New York and your Medicare Advantage happened to be in San Mateo County, the plan will cover you as if you were in network. So this is only in emergencies. That's not to say that they're not going to try to bill you as out of network, but you're right is that they shouldn't. If in emergency, you could be anywhere in the country covered as in network. Medicare and Medigap, anywhere they accept Medicare, you're good to go.
Perfect. The next question is, what is the low income range for Medi-Cal in California?
So there are different programs and different steps, and they trigger around the federal poverty level. So for example, you would have to be under 150% of the federal poverty level in order to qualify for full Medi-Cal. What does that mean? And there are tables. I don't have the numbers on my head here, but depending on your household size. So if you're, for example, a household of one person, your range might be somewhere around $20,000 income or less. If you are a household of 5 people, then your eligibility is income is higher. So again, it really depends on where you are and how big is your household and which program exactly are you signing up for.
And again, we always suggest that if you even sense that you have any inkling that you may qualify for Medi-Cal, just apply for Medi-Cal.
Exactly.
Because that's the easiest
If in
way
doubt,
to
always
answer.
apply.
Exactly. The next question is, could Maha explain the IRMA surcharge and the additional costs by income level?
Absolutely. So there is, starting with, I think it was the Bush administration, they came and says, well, not everybody should be paying the same premium. So we're going to call something called standard premium. A standard premium mean, remember that number I said around $175 a month for Part B. This is good for everybody that has income. If you're single, $100,000 per year around, or if you're filing joint is $200,000 per year. If your income goes above that, then you have this IRMA index, which means you get to pay more for your Part B and your Part D. Regardless which plan you have, you always have to pay extra. And that kind of the scale keeps going up. So if you make $500,000 or above, you could potentially be paying $500 a month extra in Part B, which is income index. This is the first thing. And again, there are tables for every year that tells you what the level is. The second thing to notice is that the Social Security Administration is the agency that determine your premium. And typically at the end of the year, they send you something saying, dear Mr. So-and-so, here's your premium for next year. And if you see anything other than the standard, then a flag should be set. Because what happened is they look at your income from 2 years ago. They have reach into your IRS record. They look at your filing from 2 years prior, and they look at that income, and you say, based on that income from 2 years ago, this is going to be your premium. Now, you don't have to accept that. You could actually appeal it, and you would say appeal it as quickly as possible. And there's something called life event. So you can go there to Social Security and say, look, I have a life event. And say, well, what's your life event? Well, my life event, I was working. I'm not working anymore. 2025, I'm not going to be making anywhere near what I was making 2 years ago. So please reassess my premium. The Social Security will review and does that. If somebody got married, somebody get divorced, somebody died. So there's certain very basic life event. A life event is not, I sold my house and made a lot of money 2 years ago. That's not a life event. You just have to wait until the next year when that amount is not showing up in your tax record for your premium to go down. But again, we tell people, please look at your premium, review it, go to the Social Security office as soon as possible, because they're not going to give you money back. So if you only discover that in July, then you'll be paying the higher premium from the beginning of the year, and they're not going to give you that money back. So do it as soon as possible.
The next question is, I believe Linda says that I'm paying Medicare through my Social Security. Does it go to Stanford's HealthNet Medicare plan? And she also asks, when I'm paying for HealthNet program, am I paying into my Medicare coverage?
I guess I'm not really clear. Are you clear on the question?
So I think,
if you're collecting Social Security,
yeah. I just want to clarify, because I think what she means, I'm assuming, for Stanford HealthNet, because I don't believe HealthNet is available individually. I could be wrong, but I'm thinking through the employer group that she has. But
so
I could be wrong.
Can you read specifically the question?
Sure. It says, if I'm paying Medicare through my Social Security, does it go into Stanford's HealthNet Medicare plan? So that's the first question.
Well, I mean, the answer is no. There is no money individually for you going between Medicare and your health plan. So whatever you're paying in your Social Security that is tied to original Medicare, and if you're signed up into a Medicare Advantage plan, Medicare is giving money to this Advantage plan on a whole basis, not just for you, for the entire plan. So my answer would be no, but to really be clear, I would say call us so we know the exact situation.
And the next question she asks is, when I'm paying for my HealthNet program, am I also paying into Medicare coverage? So
I'm not really sure what the HealthNet is. So I wouldn't want to really answer a question, of course, because I don't know what the HealthNet is.
Of course. The next question is, new to Medicare. I'll be 65 in September, and I'm still employed and enrolled in HSA. Should I not enroll in Part A because of my tax penalty until after I decide to retire from my employment?
Okay, this is a very, very good question. So what happened is, if you, remember I said earlier, if you are working, you don't have to enroll in Medicare. But a lot of people do enroll in Medicare Part A because it's free. However, there is one situation where people don't, we say don't enroll in Part A. What happened is, if HSA is tied to a high deductible plan, if you enroll in Part A, that's not a high deductible plan. So right there, that's a problem. You cannot have a high deductible plan on Part A. That's the first problem. The second problem is, let's say you have this HSA, and you do enroll in a Part A, you could still have your HSA, but you are not allowed to contribute, and your employer is not allowed to contribute. Okay, so your plan is still there because you can use the money that's in there, but you cannot add any more money to it. Now, the other situation is if you did not enroll in Part A. You say, I'm just not going to enroll in Part A, and I'm going to still be covered under my employer HSA, high deductible plan, and I have my account, my custodian account. And then 2 years later, I'm going to go on Medicare, which is fine. Now, what happens is the month you apply for Part A, there's a look back period of 6 months where you are deemed enrolled in Part A. Even though you're not enrolled, they deem you enrolled. So 6 months before the from the application date backward 6 months, you have to make sure you're not making any contribution to your HSA account. Otherwise, you're going to get penalty on your tax return. And again, it could be a little tricky. So if you don't quite understand what I just said, we'll be happy to sit down with you and explain it. But the rule is flag should go up if you have an HSA and signing up for Medicare or soon to be signing up for Medicare.
The next question is less complex. I'll be 65 in October and working full-time. Do I need to enroll in Medicare Part A or B? Do I get charged a penalty if I don't?
Again, if you are working and cover under an employer plan, there is no problem. You can delay your enrollment. If you are not working and you just don't want to have health insurance, that's a completely different story. And the answer is yes, absolutely, there are penalties. So there is something called Part B late enrollment penalty. So for every 12 months that you have delayed your Part B enrollment, you get assessed 10% additional premium. So if the premium is $185, you will be charged a 10% extra, and that 10% will stay with you for the rest of your life. If it's Part D, the drug plan, if you don't enroll and you don't have what's called a credible coverage, maybe an employer coverage or another coverage, then for every month you delay enrollment, there's a 1% penalty that get added on to the standard premium. And again, that stays with you for the rest of your life. So you need to be aware of delaying enrollment if you are not in an employer plan.
The next question is, can you clarify when you go on Medicare Advantage, can you not go back to Medicare?
Yes. So when you first become eligible for Medicare, you get your Part A and Part B, the original Medicare, and there you have the choice to take a Medigap, and Medigap is guaranteed for 6 months from the day you get Part B. If you choose not to take it and to go to an MA plan, you could do that. However, there's something called a trial period. So basically they said, fine, you want to try it, go try it. You try it, you cannot stay on the MA plan more than 12 months. If you stay on the MA plan more than 12 months, you no longer have a guarantee to get a Medigap. What does a guarantee mean? Guarantee means that you can go to any Medigap company and say, I want to buy a plan. And they cannot say no. They cannot say, we're going to charge you more. They cannot say, we're going to give you a medical exam. They might take you, but that's completely up to them. But you no longer have, if you pass that trial period, you no longer have that guarantee to go back to Medigap. It's completely at the mercy of the Medigap private company. Again, we emphasize this Medigap have very limited times where you are able to get that guarantee. One of them is when you turn 65. One of them when you have that trial period. One of them if your Medicare insurance premium leave the county altogether. Not you, them. You move. Let's say you were living here and decided to move to Florida. Your MA plan is no longer in Florida. You would get that guarantee back. But don't think that you can just get a Medicare Advantage when you're 65, stay on it for 10 years, and then just decide to go to Medigap and they take you. They're completely up to them.
Hey, Maha and Ali, this is James from the library. I see the time is 8:11. How about we squeeze in 2 more questions?
Okay.
Sounds
Go
good.
ahead, Ali.
The next question is around concierge PCP or medicine and the coverage by Medicare. Is there any coverage when it comes to concierge medicine?
So concierge benefit is something completely up to you. It's private. Medicare has nothing to do with it. So there are medical groups that would say you pay X amount and you will get an appointment the next day. If that's something that you want, go for it. But Medicare has absolutely nothing to do with that.
The next question is, how do I sign up for Stanford Healthcare Gap Plan? Which I don't think that
there is no such a thing as a Stanford Healthcare Gap Plan. A Medigap plan, if you go to a doctor in Stanford and the doctor is open for Medicare, and I believe most of them are, and accepting new patient, if they're accepting new patient. If you have Medicare, then basically your Stanford doctor sends the bill to Medicare, and Medicare sends it to whichever any Medigap you choose. They're totally agnostic. There is no such a thing as a Stanford Medigap. Any Medigap would work for Stanford as long as you have original Medicare and your doctor is a Medicare doctor.
That's 2 questions.
All right.
So
All right.
maybe it's just one thing for Ali. Ali, do you want to say anything about the ongoing presentation that you make if somebody has more questions?
Oh, yes. So on the 3rd Wednesday of every month, if you reach out to HICAP, and we have a Zoom meeting that we basically go through all sorts of questions. We demo the Medicare's website, and we usually we have a smaller crowd, and therefore we can always address that question if there's any questions you may have. The other thing I would say is, because we're reaching open enrollment period, one thing I highly suggest, if you have the slightest question about Medicare Advantage or anything like that, please call HICAP as soon as possible, because we get booked really fast. We are free. We are, unbiased, and therefore there's a lot of questions that come in, not only for people new to Medicare, but people essentially who have Medicare that calls every single year. So therefore, I highly suggest to call and make your appointments. There's an hour and a half dedicated to you to answer any questions you may have.
Great. Hey, thank you, Maha. That was just amazing. You're a walking encyclopedia. And yeah, thank you, Ali, for doing the Q&A. And I want to also thank our audience for joining us tonight and for all the great questions that you sent in. And so I just want to wrap up by saying that if you want additional information, please contact HICAP. The number is 1-800-434-0222. So again, HICAP, and the number is 1-800-434-0222. And we hope you'll join us for our next lecture. And good night, everybody.
Thank you all.
Thank you.
Thank you.